People's ability to deal effectively with and process adversity and traumas in life in a healthy, positive way is called resilience. We can think about resilience in a social way, connected to the social network around someone. Those people who can help them cope with and make sense of trauma and adversity. So resilience is not just a capacity inside a person. For example, many people explain how they coped with a traumatic or difficult situation was by having someone they could trust listen to them and help them process and make sense of it, making use of these positive relationships in their social network. However, not everyone has positive relationships in their life, so our resilience to cope with life's adversities and difficulties is connected to the quality of our social network and the quality of our relationships. So increasing the positive relationships around ourselves and others in our social network will make it more likely that we can process the difficulties and adversities we face and build up our social resilience. However, do reflect on and hold in mind that the social distancing enforced as a public health response to the coronavirus at the moment, I'm using this as an example, forces in the opposite direction. You know, if you think about social resilience, social distancing as a public health approach makes it harder for people to connect with a positive social network and build up their resilience to this threat and to process and make sense of it in a healthy way. People with less positive social support networks around them at this time may be more likely to develop health-harming habits as a way to cope with the difficult feelings provoked by the virus, such as fear, anxiety and worry. So we can respond to this by being in a trauma-informed way, by being creative in finding ways for people to connect with others, maybe in new ways, such as through texting more, social media, video calls, more phone calls than usual, and particularly think about people who didn't have a very strong social network to begin with, because of past traumas, are going to find it harder to recreate a positive social network around them. Remember, resilience is social and not just a static character trait inside some people. So we need to connect with our social network to get through hard times and difficulties.